Well, the most common vision problems affecting children, number one would be the need for glasses for children who are either farsighted, nearsighted, or have astigmatism. As well, we do have children who sometimes develop a lazy eye, which is an eye that doesn't see very clearly. They can also develop an eye turn, where one eye will actually turn in, and they can sometimes not develop an obvious eye turn, but just have two eyes that aren't coordinating together, that tend to drift apart. Well, sometimes there's no way to know at all, because if they have a problem with one of their eyes, many children don't complain, they behave perfectly normally. You would have no idea that they have a problem with just one eye. However, if the problem involves both eyes or other issues, you might notice your child rubbing their eyes. They may complain of headaches. You might notice them squinting or struggling to see. They might complain that they're tired. They might have problems or issues in school. And I've even had some children have behavioral problems that were corrected once we gave the child glasses. Well, the Canadian Association of Optometrists does recommend that people bring their children in actually for their very first eye exam at age 6 months. And it is my experience that this is a wonderful age to examine children. They are so cooperative. We can put drops in their eyes, shine lights in their eyes. We can actually measure their prescription, see if they have an eye turn or lazy eye, and the child is extremely cooperative. After that age, and that visit we usually call the well baby check in our office, we usually like to see them again at about age 3, because again at this age they're extremely cooperative again. They can read our eye charts, and they have a good understanding of what's required of them during the eye exam. I usually like to see them again at age 4, again to make sure they're fine, and again at 5, because by 5 I'm usually getting very, very accurate results at this age. Then after that, it depends. If the child is at risk or has a problem, I'll see them every year, or perhaps even more frequently. If the child is completely risk-free and has no issues whatsoever, I'll usually see them on an every 2-year basis after age 5. Almost all problems with the children's eyes can be treated if we catch them early enough. The most common ones that we treat are obviously, as I said, people who need, children who need glasses for nearsightedness, farsightedness, or astigmatism. If a child has eyes that aren't coordinating properly and they're drifting apart and they're not controlling them when they're trying to read, then we can provide eye exercises to help coordinate the muscles and help them function properly again. For a child that has an eye that's actually turning and is completely not coordinating with the other eye in any way, that often requires eye surgery or muscle surgery to shorten the muscle and straighten the eye back out again. And for children who have a lazy eye or an eye that's not seeing properly, these children we treat by patching the good eye, forcing the bad eye to see, and basically redeveloping the neural network in the brain so they can see again through the lazy eye. Sometimes these children also require glasses because they often have 2 very different prescriptions between the 2 eyes, and sometimes they even need a referral for surgical intervention as well. Well, number 1, bring them in to see your eye doctor on a regular basis is a really good idea. As well, this is really important, that children should be encouraged to wear sunglasses. We've talked a lot today about ultraviolet effects on the eye and how damaging it can be to the eye, and it's cumulative. The more you're exposed to ultraviolet light through your life, the faster it ages the eye and causes diseases like macular degeneration and cataracts. And over 50% of our exposure to ultraviolet light occurs before the age of 18. So it's real important to get your kids to wear sunglasses. In addition to that, we also know that children who spend a lot of time indoors using computer devices, reading, handheld devices, and not spending any time outdoors are far more likely to become nearsighted. So number 1, we do recommend that parents encourage their children to spend as much time as possible outdoors playing and not spend their lives on looking at a computer screen. And if they do look at a computer screen or read even, it's good to develop good reading habits, not to sit too close, and also to take regular breaks. We call it the 20-20 rule. For every 20 minutes you stare at a computer screen or read, you should spend 20 seconds looking up, looking away at something, at a distant object, to relax your eyes And we feel this helps prevent children from becoming nearsighted, or at least it may slow it down or make it less likely that they'll become nearsighted. I really don't think that's necessary. I think most optometrists are completely capable of examining a small child, even an infant initially, to see if there are any problems. Of course, if there is an issue that does require more tertiary care or more specialized care, then the child should certainly be then sent off to a clinic that specializes in children's vision. But if every parent sent their child to a specialist or a doctor that specialized in children's vision, then they would be so swamped seeing children that there would be no room for them to see the children who really need them, who do have the severe problems. So no, I feel that children are well serviced by seeing their local optometrist or an ophthalmologist too that is interested in seeing children that has a general practice. Yes, it's very easy today to find glasses and sunglasses for children. It's not like it was years ago. There's some pretty funky styles today for kids, and they look great in glasses today. In fact, I have a lot of kids come into my office who are extremely disappointed when I don't prescribe glasses for them, because they have become a bit of an in thing at school, and kids do not seem to get teased anymore about wearing glasses. So yeah, there's some really, really cool frames for kids today. Well, I think that once they've turned 5, that many children can see an eye doctor every 2 years. However, there are children who do need to be seen on a yearly basis or more frequently, and your eye doctor will let you know how frequently your child should come in.